Good afternoon and welcome everyone to the Senate Select Committee on Health and Wellness for the 36th special session. Madam Secretary, please proceed to call the roll.
Senator Buck. Here. Senator Cruz Crawford. Here. Senator Lang. Here. Senator Stone. Senator Taylor. Chair Doniate.
And I'm here, and thank you so much. Good afternoon, and thank you everyone for attending today. Welcome to the members of the audience in Carson City, Las Vegas, and those who are following our meeting online. Today we have introductions followed by adoption of committee rules and 2 bill hearings. And so before I begin, I would like to make several housekeeping announcements. First, I would like to remind everyone to please silence all of your electronic devices while you're here in the committee room. I would also like to remind that members of the public may provide testimony in various ways, all of which are listed on the agenda. Today we will have public comment period towards the end of the meeting. You may also submit your public comment in writing, either in addition to testifying or in lieu of thereof. If you wish to testify in person, you can go ahead and sign it at the table by the door and leave a business card with the committee secretary. When testifying in person, please turn your microphone on to speak and off to listen, as we have others listening and viewing in Las Vegas and online. And please also state and spell your name for the record. Anyone who would like to receive an electronic notification of scheduled bills and access to the committee's meeting materials can do so by signing up on Nellis on the legislative website. And committee members will be using their laptops to view handouts and other exhibits, so please do not view this as a sign of disrespect or inattention. And to ensure an orderly flow of discussion, all comments, questions, and responses will have to go through me, of course, as part of the standard procedure. And of course, I will have to recognize committee members if they have any questions throughout this process. With that, I'm going to go ahead and start with our introductions. And so I would like to briefly introduce you to our committee members and our staff. For this committee, our members are our Vice Chair, Senator Lang from Senate District 7. We have Senator Cruz Crawford from Senate District 1. We have Senator Taylor from Senate District 15. We have Senator Buck from Senate District 5. Senator Stone from Senate District 20, and myself from Senate District 10. And next, I would like to go ahead and introduce our staff, who are, of course, vital to this committee while we're here for our special session. I would like to welcome Linda, who is our committee manager, Virginia, who will serve as our committee secretary, Kathy, who is our committee fiscal analyst, Mr. Eric Robbins, who's our committee counsel, and Mr. Patrick Ashton, who's our committee policy analyst. So I'd like to thank our staff for all that they will do throughout this time. Again, these are the folks that you should contact if you have any questions as we're going through this process over the next coming days. And last but not certainly least, I would like to recognize all the staff that are behind the scenes ensuring our committee meetings and the entire legislature can run smoothly, including our staff from our BPS and IT services, and of course our janitorial staff to our legislative police. So thank you all for helping us get to this moment. I want to start off today with our first action, which is the first order of business, which is the adoption of our committee rules, which are posted on Nellis. The work of the committees is governed by the standing rules and the joint standing rules. The proposed committee rules add more details for our committee meetings. You have the committee rules in front of you, and so members at this time, are there any questions regarding the committee rules? They're the pretty standard, same thing that we usually do.
I move adoption.
We have a motion from our vice chair. We have a second from Senator Taylor. Is there any discussion on this? All those in favor, please say aye. Aye. Any opposed? Motion's carried and the rules have been adopted. We are going to now move on to our first bill hearing. We're going to start off with Senate Bill 5. So just for the quick order of business, today I'm going to start off with Senate Bill 5. After we're done with Senate Bill 5, we'll go through the process of doing the presentation, questions, and then testimony. After Senate Bill 5 is done, we will take a brief recess for committee members to go use the restroom, get water, etc. And then we will come back to do Senate Bill 3, and then we will take another recess after that. So we'll see how far we go. And so at this point, I would like to go ahead and open the bill hearing on Senate Bill 5. This bill makes revisions relating to healthcare, and I will go ahead and invite our majority leader to begin when she is ready.
Thank you, Mr. Chair and members of the committee. My name is Nicole Canizaro, and I proudly represent Senate District 6 in the northwest portion of the Las Vegas Valley and also serve as your Senate Majority Leader. I am very proud to be here today to begin the presentation on Senate Bill number 5. You may remember parts of this bill as Senate Bill 434 from the 83rd regular session, which I also sponsored and presented to members of the Health and Human Services Committee. This bill that is before you and what was contained in part of Senate Bill 434 created a program to award grants to address shortfalls of providers of healthcare, or what we are calling Centers for Medical Excellence. Senate Bill 5 also incorporates two key provisions from Senate Bill 495 of the 83rd session, which was the governor's health care bill, to expedite the licensure process for physicians in Nevada and help speed up hospital privileging decisions for providers. With me today to present is Allison Genko and Melinda Southard from the Nevada Health Authority. I will begin with a brief refresher on just the Centers of Medical Excellence provisions before passing it off to Ms. Genko to touch on the physician licensing and hospital privileging portions of the bill, and then Ms. Southard is available to answer any technical or implementation-related questions that you or the committee members may have. I think widely there is global recognition that Nevada is behind with respect to access to healthcare services, particularly with respect to provider shortages, expanding healthcare infrastructure, and advancing innovative healthcare models. In our state, these shortages are particularly extreme in all areas of specialized care. And so when one of our loved ones faces an acute medical crisis, whether it be in the form of a cancer diagnosis, heart disease, a diagnosis of Alzheimer's, or other life-changing or threatening diseases, oftentimes families and Nevadans are faced with the dire decision of whether to stay in Nevada, where we have an insufficient number of medical specialists, or to potentially leave the state, if that is something that they can afford to do, to seek care away from home, taking them from their support system, their family, their loved ones, and everything that you sort of need to make sure that you can get a successful health journey along the way. This is simply unacceptable. And I said this during the last legislative session, and I will say it again. This is unacceptable, and it is time that we take some action. Currently, 71.9% of healthcare occupations in Clark County, 60.7% of healthcare occupations in Washoe County, and 82% of healthcare occupations in Nevada's rural counties are below the national average of the concentration of professionals compared to the number of Nevadans. In simple terms, we are behind in every area of the state when it comes to the number of healthcare providers that we need to support all Nevadans. Nevada ranks 45th in the United States for active physicians per 100,000 population, and 48th for primary care physicians, 49th for general physicians. Currently, in 33 of 39 specialty areas, per capita rates in Nevada are below the national average, including radiation oncology, cardiovascular disease, and neurological surgery. And in 25 of 39 specialty areas, the number of physicians has not kept pace with the population growth over the past decade. In an effort to address these issues, Senate Bill 5 introduces the statewide Healthcare Access and Recruitment Grant Program to provide financial incentives for healthcare access and healthcare workforce expansion. There are a wide variety of entities that are eligible for funding under this competitive grant program, including healthcare providers, educational institutions, and nonprofits for both new and existing providers. The grant will be funded with a $60 million appropriation from the State General Fund. The original language, for those of you who had the opportunity to take a look and to hear some of the testimony on Senate Bill 434, the language in that particular bill was amended to address some of the concerns and ongoing questions regarding the funding mechanism. It is my hope, and I want to be very clear about this, that it is my hope that if Senate Bill 5 is passed, that the legislature will find consensus on a long-term funding solution and mechanism to help address the state's chronic provider shortages in the next regular session. That was what we were trying to do with Senate Bill 434, but this is a critical step forward, and I think that we have to approach this with the understanding that that is the next task at hand if this bill passes, to make sure that we are continuing to support and to fund the ability for every Nevadan to get access to the healthcare that they need here in Nevada. Additionally, I will note for members of the committee, you should have a conceptual amendment available to you. This amendment increases the share of funding available to the Nevada Health Authority from 2% to 3.5% and updates Nevada law to allow pharmacists to administer immunizations in accordance with federal immunization standards and CDC recommendations as of January 1st, 2025, along with any future modifications adopted by the State Board of Health. And I am getting the sense that we may not have that language, which I'm happy to discuss at further length, as I saw that everyone was sort of looking around for that. We will make sure that we get you a copy of this, Mr. Chair and members of the committee, and my apologies. I thought that we had sent that in, and I know we've been having some technical difficulties this morning and afternoon. So I will make sure that you get that language. But obviously the intent of this is to ensure that we are able to let people who want to have some of those immunizations get access to them. I am going to now hand things over to my co-presenters, Mr. Chair, and then of course I would be happy to, after that testimony, present any closing remarks and stand ready for any questions.
Good afternoon, Chair and members of the committee. For the record, my name is Allison Jenko-Herzik, and I serve as Chief of Staff to the Nevada Health Authority. This bill includes portions of the Governor's Healthcare Policy Bill, Senate Bill 495 from the 83rd session. Specifically, these provisions include the sections of that bill that decrease the timeline it takes for providers to be onboarded to provide services so that the state can more efficiently address gaps in access to healthcare in Nevada. Under Section 19 of the bill, hospitals must process at least 95% of complete requests for privileges to perform hospital services from providers of healthcare not later than 60 days after receiving all the information necessary to complete such a request. Per Sections 29 through 35, the Board of Medical Examiners and the State Board of Osteopathic Medicine must establish by regulation a procedure for prioritizing applications for licensure as a physician or osteopathic physician if such applicants plan to, 1, serve underserved geographic areas or populations in Nevada, or 2, practice a specialty for which there is a shortage in Nevada as determined by Section 29. This concludes my remarks, and I will pass it back over to the Majority Leader.
Thank you so much. Nicole Cannizzaro, Senate District 6. Senate Bill 5 really does represent a very significant step towards strengthening Nevada's healthcare workforce. By allocating these funds strategically and ensuring oversight, the bill aims to address longstanding provider shortages and to improve healthcare access statewide. Not only do we need to address the shortages of healthcare providers that we face, but we also want to attract the best and the brightest in the nation. And we in Nevada can do this. As a generational investment in healthcare, this bill does set out to address the challenges that we face as a state with a mechanism that incentivizes the emergence of centers of medical excellence and to help address those provider shortfalls and access shortfalls throughout the state. And this is going to allow us to establish a complete healthcare system that Nevada deserves and that every single Nevadan in this state deserves. And with that, Mr. Chair, that concludes my remarks. We would be happy to take any questions that you or the committee members may have.
Thank you. Committee members, any questions? And we're currently working on getting the printed copies of the amendment and getting it uploaded. Just bear with us, folks. Senator Stone.
Well, thank you very much for the presentation, and I certainly support the theme of what we're trying to accomplish here today, and I applaud you for bringing this forward. Can you just talk about, you were mentioning that in order to get hospital privileges, that this is going to require the hospitals must act on an application within 60 days. How long is it taking today? And it's still going to give hospitals the authority to reject applicants that don't meet the qualifications in the state or in the hospitals, I assume.
Thank you for the question, Senator Stone. Allison Jenko-Herzik for the record. Unfortunately, I don't have that specific answer as to how long it takes, but I can provide you with some follow-up information after this.
Okay, so could you talk about some of the tools to expedite applications and how we can get that done in 60 days? What is the changes that are going to be required of hospitals other than just a deadline to process an application?
Thank you, Senator Stone. Allison Jenko-Herzik for the record. We hope to educate the hospitals on the changes in this bill, and would hope that they would be open to some dialogue with us, so that way that it's not right away. They have a little bit of time to implement and communicate with their members as well.
Okay, thank you.
Any other questions? Senator Buck.
Thank you so much, Chair Donate. In Section 10, 3F 1 and 2, all patient care funded by the grant will be provided in the state, requiring that healthcare grant recipients must demonstrate they will provide all patient care in the state of Nevada. Can you talk a little bit about that process?
Thank you for the question. Through you, Mr. Chair, to Senator Buck, Nicole Canizaro, Senate District 6. So the intent in Section 10 was to make sure that we really are investing in Nevadans. So we want that to be part of the consideration. Again, these are grant dollars that can be applied to by entities who may meet the qualifications that are set forth here. And then there's a whole approval process that also involves the legislature to award those dollars. And I think the whole intent here, right, is that we are incentivizing providers to come to Nevada, to bring their specialists, to provide care, so that Nevadans, we don't have to look at leaving the state when our loved ones are ill, that we can find that care here. And we wanted that to be an important consideration for whether or not entities would qualify for healthcare dollars from this grant program.
And if I may, Chair. So I know a few years back, it may have been 6, 7, 8 years back, healthcare providers were leaving the state because of the medical malpractice. Insurance was too high. I know there was billboards all over. So can you speak to that? Have we tracked that as to how many are coming back, or if that's a fine line that we haven't crossed or are going to cross?
Thank you for the question. Through you, Mr. Chair, to Senator Buck, Nicole Canizaro, Senate District 6. So I would venture to guess, and I will say I don't have any numbers to provide to you on that. I would venture to guess that there are a wide range of reasons why it is tough for providers here in Nevada. Part of that is that we lack infrastructure. And I think that part of that relates to the pieces of this bill that deal with hospital credentialing processes and with physician licensing processes. And I think that that is really the intent of this bill, that where we see deficiencies in access to healthcare, that we should be addressing those. And so I know this is an attempt to say, if you are providing specialty care, we want to provide grant programs to allow for that expansion. That if you are a physician or you're looking for hospital credentialing, or there are lack of access here in the state to healthcare, that we are working in various ways to address that, because that, I think, fundamentally, that is something that Nevadans deserve. That is something that if you go out and you talk to families and anybody who's had a major health crisis, this can take over your entire life, trying to figure out, how do you deal with the care? How do you find the right doctor? How do you find the right provider? We really have to take, I think, a multifaceted approach to ensuring that those gaps do not exist. I think that this is one piece of that puzzle, and I believe very strongly that this will help us to continue to recruit and to retain the very best here in the state, because we are going to be providing the kind of care that excites people and the kind of care that makes them eager to go to work every single day and take care of patients.
Thank you.
Any other questions? Senator Stone.
Thank you, Mr. Chair, for indulging me. Can you talk about how this bill is going to effectuate the expeditious review and approval by the medical boards here in Nevada? I'm sure they share a lot of responsibility, and we having qualified applicants coming into the state and throwing their hands up saying this process is just too complicated and too cumbersome. How are we going to break that logjam, if you will?
Chair Doniate, members of the committee, Allison Jenko-Herzik for the record. Thank you for the question, Senator Stone. In the bill, there is language that the licensing boards have to work in conjunction with the health authority on this data, and they'll be able to work together to identify those providers or areas where we're seeing low provider retention or where we need increased providers. I hope that answers your question.
Any other questions? Nope. Okay. At this time, I will go ahead. We might have questions depending on what the amendment says as it's being handed out, so just be prepared. I'm going to go ahead and open it up for testimony and support, and then we'll go to opposition and neutral. We'll allocate, 30 minutes. Let's see how far we go. So folks can come forward, and we'll start here in Carson City, and we'll allocate 2 minutes per person. And you may begin.
Good afternoon, committee. Sheila Bray with the University of Nevada, Reno. We are in full support of this bill and thank Senator Cannizzaro for bringing it forward. Thank you.
Chair Doniate and members of the committee, my name is Alyssa Nave, Cornerstone Government Affairs, here today on behalf of City of Hope. We're here today in support of Senate Bill 5 by fostering competition among world-class institutions to invest in Nevada. The bill will not only bring advanced treatment options closer to home, but also expand the state's healthcare workforce in areas of greatest need. It will catalyze collaboration amongst community clinicians, academic institutions, biotechnology innovators, and the broader healthcare ecosystem, creating a foundation for long-term measurable improvement in the lives of Nevadans. For these reasons, City of Hope proudly supports Senate Bill 5 and urges the committee's favorable consideration of this vital legislation.
Good afternoon, Chair, members of the committee. Elliot Mellon for the record. On behalf of the Nevada Osteopathic Medical Association, we want to thank the Senate Majority Leader for bringing this and the Governor for including it in the proclamation, and we support this legislation. We think it'll help Nevadans. Thank you.
Good afternoon, Chair Doniate, members of the Health and Wellness Committee. Leonardo Benavides here on behalf of UNLV, here in strong support of SB 5. We think this directly addresses Nevada's critical shortage of healthcare professionals by creating this competitive grant program to recruit, train, and retain providers across medical specialties. The UNLV Kirk Kerkorian School of Medicine stands ready to lead as a training and innovation hub that develops physicians who stay and serve in Nevada. So, in short, this is a great bill. We thank Senator Cannizzaro for bringing this, and Governor Lombardo as well for including the proclamation. Thank you.
Chair Doniate, members of the committee, Connor Kane with HCA Healthcare and the Sunrise Health System in support of Senate Bill 5. As many of you know, we recently opened a world-class Sarah Cannon Cancer Network Day Hospital at Mountain View, the first and only program in Nevada dedicated to treating blood cancers. We continue to explore opportunities to bring world-class care to our state and believe that Senate Bill 5 can help those efforts. We thank Majority Leader Cannizzaro and Governor Lombardo and encourage your support of this bill. Thank you.
Good afternoon, Chair and members of the committee. Samantha Barnes for the record, and I'm here in support on behalf of Comprehensive Cancer Centers of Nevada, the largest independent community-based cancer treatment provider in Southern Nevada. We appreciate your leadership in addressing Nevada's ongoing healthcare access challenges and strongly support the creation of the statewide health care access and recruitment grant program. This initiative is a critical step towards strengthening our healthcare workforce and improving access to care across our state. We value providers who enter the Nevada market and commit to caring for a meaningful share of Medicaid and underserved patients alongside us. And we appreciate the language included requiring Medicaid patients within the payer mix and the good faith commitment to keeping care in Nevada. Thank you for your thoughtful consideration and partnership in advancing care for all Nevadans. We are committed to ongoing engagement and cooperation to strengthen our healthcare system together. Thank you.
Good afternoon, Chair, members of the committee. For the record, Alejandro Rodriguez, Nevada System of Higher Education, and she is in support of SB 5 and is committed to partnering with the Nevada Health Authority to implement the provisions of this bill in an effort to expand our healthcare workforce. We'd like to thank Senator Cannizzaro and Governor Lombardo for pushing this forward. Thank you.
Good afternoon, Chair Doniate and the committee. My name is Nancy Bowen. I'm the CEO for the Nevada Primary Care Association. We represent the federally qualified health centers in our state, which make up a large portion of the safety net, and we are in support of this bill. Thank you.
Chair Doniate, members of the committee, Dan Musgrove on behalf of the Valley Health System of Hospitals and U.S. Anesthesia Partners. We are in support. We thank the Majority Leader and the Governor. Thank you.
Good afternoon. My name's Patrick Kelly with the Nevada Hospital Association. We support and commend this legislation. What we ask is that we maintain a level playing field so that all providers have an opportunity to access the information. And a couple things that to keep in mind is entities receiving the fund should demonstrate that all the services and programs developed through this initiative directly support healthcare services and patients within the state of Nevada, and that patient participating entities should serve a substantial portion of Medicaid beneficiaries or other underserved groups to ensure that the benefits of the program reach those most in need. Funded projects should address significant unmet need within our community and provide meaningful benefits to many Nevadans. And finally, to maintain focus and clarity, we should keep all unrelated provisions out of this bill that we can. Thank you very much, and we want to thank the Majority Leader and the Governor for their leadership on this issue.
Good afternoon, Chair Doniate and members of the committee. My name is Elisa Cafretta. I am the Executive Director for the Children's Advocacy Alliance. We are here in support of SB 5 because we think this bill addresses a critical need to grow new providers in Nevada, and especially pediatric specialists that are so important to serving our families in Nevada, and that's why we urge your support.
Good afternoon, Chair and members of the committee. For the record, my name is Annette Magnus, and I am here today representing my client, the Retail Association of Nevada. We want to thank the Governor and all of your staff for their hard work on this important bill. We also want to thank the Majority Leader for bringing this important bill forward. We are all for anything that can encourage efficiency and making our healthcare system better, and we urge your support. Thank you.
Good afternoon, Senators. For the record, Paul Murat from the Vegas Chamber. The Chamber is in support of SB 5 and appreciate your efforts today. Thank you very much.
Thank you so much. Anyone else here in Carson City? Anyone in Las Vegas? BPS, is there anyone online?
Thank you, Chair. To testify in support to Senate Bill 5, please press star 9 now to take your place in the queue. Caller, please press star 6 to unmute. Caller with the last 3 digits of 419, please press star 6 to unmute. You're unmuted, please proceed.
Thank you, Chair Doniate and members of the committee. My name is Benjamin Challinor. That's BenjaminChallinor. On behalf of the Alzheimer's Association, the nearly 55,000 Nevadans living with Alzheimer's, and their 89,000 caregivers, I'm here in support of Senate Bill 5. This bill can help address Nevada as it's known as a neurology desert, meaning we have less than 1 provider per 10,000 Nevadans living with Alzheimer's. This is key because as many Nevadans are in search for a timely and accurate diagnosis, they won't have to delay access to new FDA-approved treatments that depend on an early diagnosis. Thank you, Majority Leader and Governor, for including this in the proclamation, and we urge your support.
Good afternoon, Chair and members of the committee. My name is Casey Melvin. I'm an occupational therapist and the CEO of Tilton's Therapy and Tilton's Therapy for Tots, a statewide mobile outpatient occupational therapy, physical therapy, and speech language pathology provider serving families across Nevada. I support the intent of SB 5 to expand access and strengthen our healthcare workforce. As a provider delivering care in homes and communities across both urban and rural regions, we see every day how workforce shortages in therapy directly affect children with developmental delays, individuals with disabilities, and medically fragile Nevadans. I respectfully ask that OT, PT, and speech be explicitly included in the statewide workforce assessment. Nevada faces severe shortages in these professions, landing as 50th in the nation for provider to population ratios for all three, causing long wait lists that lead to delayed development, slower recovery, and preventable complications. I also encourage flexibility in the matching requirements. Small and mid-sized practices, rural providers, and community-based organizations often serve the highest need populations, but may not have the same capital resources as large systems. A tiered or expanded in-kind match would allow more providers to participate meaningfully. Additionally, please ensure that mobile natural environment telehealth models are eligible for funding. Finally, I want to highlight that therapy services offer a very strong return on investment. Skilled therapy interventions reduce hospitalizations, emergency room use, fall-related injuries, and long-term care needs, saving the state significant downstream costs. Thank you for your consideration and commitment to strengthening Nevada's healthcare workforce. I really appreciate your leadership in our healthcare system. Thank you.
Good afternoon. My name is Jessica Garrett. That is Jessica-Garrett. I am a speech language pathologist and the owner of a multidisciplinary pediatric clinic providing speech therapy and occupational therapy across the Las Vegas and Henderson areas. I'm here in support of SB 5, a bill that represents a meaningful step towards strengthening Nevada's healthcare and improving access to essential services. As a healthcare provider and private practice owner, I understand firsthand the challenges that come with delivering high-quality pediatric services in a state facing significant provider shortages. Nevada consistently ranks among the lowest in the nation for access to care, and this includes allied health fields such as speech-language pathology, occupational therapy, and physical therapy. These shortages directly impact the children we serve by creating wait lists, delaying early intervention, and limiting access to specialized services that are critical for developmental outcomes. In addition to current issues, we also face barriers related to hospital privileges that were previously mentioned and increasing turnaround times. Providers often face insurance credentialing issues, which take 3 to 6 months per provider. That's with private insurance companies, including Medicaid MCOs, as well as decreased reimbursement rates where other states have higher rates and quicker turnaround times for insurance credentialing. So this serves as a barrier. I think this bill is a step in the right direction. Early access to speech therapy, occupational therapy, and developmental services is critical. Delays in care can result in long-term challenges in communication, academic readiness, and overall participation in daily life. SB 5 lays the groundwork for a statewide effort to reduce these delays by expanding capacity, increasing provider availability, and addressing systemic barriers to timely care. I strongly encourage the legislature to advance this bill and prioritize the inclusion of multidisciplinary and allied health providers within its implementation efforts. Thank you for your leadership and for considering the significant positive impact this bill can have on Nevada's families and the healthcare workforce that supports them. Thank you.
Chair, there are no additional callers in support at this time.
Thank you so much. Anyone else here? One more time. I don't see anyone here in Carson City. Let's go to opposition. If you are opposed to this bill, please come forward. I don't have anyone here or in Las Vegas. AVH, is there anyone online?
Chair, we have had no additional callers to the line at this time.
Thank you so much. Next, we will go to neutral. Is there anyone that would like to provide neutral testimony? I don't have anyone here or in Las Vegas. AVH, is there anyone online?
Chair, we have had no additional callers to the line at this time.
I don't think our co-presenters are here, so I'm going to go ahead and close the hearing on this bill. I'm sorry. I'm going to go ahead and close the hearing on this bill, and we will now go into recess. Welcome back from recess. We are now going to go on to our next bill hearing, which is for Senate Bill 3. I'm going to go ahead and open the bill hearing for this bill. This bill revises provisions relating to public assistance, and I will invite back our majority leader to begin the presentation when she is ready.
Thank you, Mr. Chair, and members of the committee. Again, my name is Nicole Canizaro. I represent Senate District 6 in the northwest portion of the Las Vegas Valley, and also serve as your Senate Majority Leader here in the Senate. And I am pleased to be with you this afternoon to present to you Senate Bill number 3, which revises provisions relating to public assistance. I am pleased to be here today with Administrator Robert Thompson from the Division of Social Services and with Debbie Reynolds from the Governor's Finance Office. Senate Bill number 3, members of the committee, establishes what we are calling the Silver State General Assistance Program within the Division of Social Services of the Department of Human Services. Before I begin, I do want to take a moment to acknowledge the collaboration from the Division of Social Services for their tireless work in helping to develop this program under extraordinarily tight timelines. Their commitment and the governor's office commitment to making sure that Nevada is better prepared for future disruptions, I think has been invaluable and is what, God bless you, has enabled us to be here today to present what I think is an important piece of legislation. Senate Bill 3 was brought forward because Nevada must be prepared. We must be prepared for the next crisis long before it arrives. The recent federal government shutdown and the jeopardization of SNAP and WIC benefits for Nevada families made one thing very painfully clear, is that when federal systems fail, it is our most vulnerable residents who pay that price. As a state, we cannot allow that to happen again. We just can't. When Nevadans lost access to SNAP during the shutdown, families across the state were left choosing between groceries, rent, and basic necessities. Food banks were strained, and thankfully the legislature and the governor worked together to address these shortfalls. But we should never have to scramble in that position again. Senate Bill 3 ensures that Nevada has a clear, accountable, and immediate mechanism to protect families when federal support falters. It ensures that seniors, children, people with disabilities, and working families are never again placed at risk because of political dysfunction outside of our borders. Senate Bill 3 creates a permanent framework rather than an ad hoc emergency patchwork to provide temporary financial or in-kind support to individuals and households facing what the bill defines as an extraordinary circumstance. These extraordinary circumstances include any disruption, suspension, or reduction in federally or state-funded public assistance programs. In other words, when Washington, D.C. cannot deliver, Nevada must be ready to step in. And so this bill authorizes the state to provide assistance in the forms of cash, electronic benefits, vouchers, or other in-kind supports. Importantly, it does so within existing administrative structures and allows for presumptive eligibility by linking the program to other means-tested public assistance programs already administered by the division, such as Medicaid, TANF, LIHEAP, or SNAP itself. This design ensures that rather than forcing families to navigate multiple applications during a crisis, the state can deliver rapid, targeted relief when time is of the essence. With respect to the funding mechanism, and I think that this is an important piece because there has been maybe some misunderstanding is how we could characterize it, of how it is that the state has the ability to address a crisis like we just saw with the SNAP benefits not being administered at the federal level. Senate Bill 3 authorizes the transfer of funds from the unrestricted balance of the state general fund, but only under certain strict conditions, including maintaining a minimum ending fund balance and a gubernatorial declaration of an extraordinary circumstance. The recommendation for a transfer of funding would originate with the GFO director before going to the Board of Examiners, and then with IFC providing that final approval. These safeguards ensure that Nevada is fiscally responsible while still maintaining the flexibility required to address real-time emergencies. One of the things that we struggled with in this latest shutdown, where families were left without the funds to provide food to feed their children. And an overwhelming majority of SNAP recipients are families with kids. Those families struggled. And where we struggled as a state is that we do not have a mechanism to have put money to use to deliver directly to Nevadans. With our current mechanisms, we can certainly declare a fiscal emergency with GFO and IFC, but all that does is trigger money from the rainy day fund to flow into the general fund. That buffers current appropriations. The legislature has no mechanism to address this. So that is not a solution to what it is that we saw happening. And when I saw that, I reached out and said, hey, we have to try to figure out what actually looks like a workable solution. What mechanism can we put in place? Because we can talk about a fiscal emergency all we want. We can talk about rainy day funds all we want. But if the legislature is not in session, we didn't have a way in which to direct that money to families who needed it. And that is how come you saw collaboration between the governor and the legislature to help bolster food banks to deal with food insecurity in the best way that we could find possible. And so this sets up a mechanism that would allow us to be more adept if we are in that situation again. This is something that was coming before this committee because we thought we were going to have to walk in here and fund SNAP benefits potentially throughout the rest of the year and to fully fund them. Luckily, I will say that we did have some relief, right, because of a court decision and the work of many attorneys general across the nation, including our own, to challenge that decision. And now, of course, there's movement in Washington, D.C. to release those funds and to provide that funding. But if you had asked me months ago if I thought that hungry children were going to be pawns in a political game, I would have told you that's crazy. But that's exactly what we saw happen. And so we have to have something that we can actually utilize if we find ourselves in that position again. And so this will exist. If we have to utilize this mechanism, I think it is important to note that it does not jeopardize the state from a financial perspective. It allows us to just be more adept to address immediate, necessary needs. And it's the collaboration between the legislature through its interim finance committee and also the governor's office through GFO to make sure that we are addressing that. This lays out that foundation for long-term resiliency. Federal shutdowns and federal program disruptions, they're not hypothetical because we just lived it. They are recurring events, and we cannot be caught flat-footed the next time. With that, Chair Gignante, I am happy to answer any questions, but I am going to turn it over to my co-presenters to walk through any pieces of the bill that they would like to highlight. And then I think one other thing I wanted to note is that we do have a conceptual amendment, which hopefully the committee has received. It is quite simple in its language. It is simply to delete sections 14 and 15. Obviously, this was a solution that we had worked on and had spoken with the governor's office about for inclusion in this special session, and have worked with our state agencies to ensure that we were going to be able to provide SNAP benefits, to fully fund those for the month of November, and then to fund them potentially into December, provided that that would be available in this bill with that funding piece. But obviously with the federal government shutdown ending and those SNAP benefits coming online, we do not need that appropriation to exist in this bill, but rather we set up the structure and then would allow for that mechanism to be utilized if we need it in the future. And so the conceptual amendment is just to delete sections 14 and 15, which are the functional appropriations of money for those purposes. And so with that, Mr. Chair, I will turn it over.
Thank you, Senator. For the record, my name is Debbie Reynolds, and I serve as the Deputy Chief of Staff to Governor Lombardo. Appreciate the collaboration that we've had with Senator Cannizzaro. Really, I would just add that the intent of this proposal is not to create a permanent entitlement program. It's not to duplicate federal programs. It's to ensure Nevada has a lawful and operational bridge when federal or other aid systems fail that can be implemented quickly. I could walk through briefly the sections of the bill. Section 3 defines the extraordinary circumstance that the governor would need to declare. Section 7 outlines the program eligibility. For purposes of the program, a person or household who's determined to be eligible for any means-tested program of public assistance administered by the division, this would include SNAP, TANF, energy assistance, shall be deemed preemptively eligible, which Senator Cannizzaro spoke to, for assistance under the program. And any application signed and submitted by a person or household for such a means-tested program for public assistance would be considered jointly processed. And in doing so, this allows us to use that data that's collected for the federal programs to fund and support a general assistance program. That was the challenge that we had this past go-around with the federal shutdown. Section 8 authorizes the administrator to contract with a public or private entity to perform the administrative functions of the program and to use the information systems maintained by the division to ensure the use of such information complies with federal and state law. Section 10 creates the account for the Silver State General Assistance Program. And Section 11 outlines the criteria to authorize the transfer, which Senator Cannizzaro spoke to. With that, we're happy to answer any questions you might have.
Thank you so much. Committee members, any questions? I had one quick question. First and foremost, more commentary. Thank you for bringing this forward. I've been to several conferences this year with other HHS chairs, both Republican and Democrats, who have been wondering after the passage of H.R. 1 what exactly we were going to do in terms of how we responded to the needs of our constituents, considering what the federal government has acted. And this could be a potential solution in helping Nevadans that are at need. One of the things that I had a question on in Section 7 is I want to make sure, obviously, there's a presumptive eligibility that is responsive to SNAP, TANF, et cetera. I wanted to make sure that the administrator has the flexibility for certain circumstances to go beyond, perhaps in some situations where folks may not qualify for this. So, for example, I've spoken to many of the workers that are represented by AFSCME over the last several months in terms of people that they denied because they literally were $1 over what the requirement was for eligibility. So I want to make sure in this bill, if there is an extenuating circumstance, the administrator would have the flexibility to make that approval, even if they don't meet the definition of presumption.
Good afternoon, Robert Thompson for the record. The way the bill is written would give us the flexibility through conversations with IFC and the governor's office. We would be taking direction from our lawmakers on what those criteria would be. But as written, it was written purposely to give us the flexibility to be able to meet any need.
Great, thank you. I don't see any questions, so let's go ahead and open it up for testimony and support. If you would like to provide testimony and support, you may now please come forward. And we will start here in Carson City. And I'm going to set aside 30 minutes for each side. And you may begin.
Thank you, Chair and members of the committee. My name is Amber Falgout, AMBER FALGOUT. I am the Communications Director with Battleborn Progress. First and foremost, let me start by saying I have benefited from SNAP, the Supplemental Nutrition Assistance Program. My husband, my father-in-law, and my children have all benefited from it. That's 3 generations. All of us have grown past being eligible for SNAP, but I can tell you now that I went through more than one government shutdown while I was eligible and receiving benefits. Never, not one time did those benefits stop due to a government shutdown. We are simply living in a different time. What is happening today is objectively cruel and frankly disgusting. We desperately need Senate Bill 3 so we are not in another situation where the current federal administration decides they don't care to pay SNAP benefits despite court orders or precedent. Not receiving SNAP means not having much food on the table. What does that look like for a family? Well, I can tell you. It means your kids eat and you don't. It means waiting for them to finish their food and eating what they've left on a plate because that is all the food you have. I've done this, my husband has done this, and my father-in-law. In the wealthiest country on earth, this should simply not be in the realm of possibility. One of the hardest things in life is to have your children be hungry despite working a full-time job or more than one job. We need SB 3 to ensure we can mitigate future disruptions. It is unlikely that this will be the last government shutdown, as we are currently in a very deeply divided environment at the federal level. Weaponizing hunger should never be tolerated, and this bill ensures that if it happens again, our state will be prepared. We urge passage on this measure and thank the Senate Majority Leader for bringing this forward. Thank you.
Thank you, Chair. Members of the committee, Jessica Ferrato, for the record, here on behalf of the United Food and Commercial Workers in support of SB 3. As the union who puts food on America's tables, the United Food and Commercial Workers knows how important food assistance is in addressing hunger and supporting jobs in our communities. UFCW represents 1.2 million workers across the country who work along the food supply chain, from grocery, meat packing, food processing, and retail. Nevadans are already struggling with the rising cost of groceries, and they cannot afford sudden lapse in grocery assistance, as we have seen over the past few weeks. This bill insulates the state and Nevada residents from future federal uncertainty. UFCW would like to thank the Majority Leader, the Governor, and this legislature for taking swift actions to support Nevada families. Thank you.
Good afternoon, Chair and members of the committee. For the record, my name is Cade Grogan with Ferrari Reader Lau Public Affairs, representing Dignity Health, St. Rose Dominican, and our 8 nonprofit acute care hospitals in Southern Nevada. In line with our mission, St. Rose is in strong support of the creation of the Silver State General Assistance Program as a critical resource for the most vulnerable Nevadans during times of emergency. Thank you.
Good afternoon, Chair and members of the committee. My name is Cassie Charles, and I'm the political representative for AFSCME, the American Federation of State, County, and Municipal Employees in Nevada. We are in strong support of this proposal and would like to thank the hardworking committee and the Senate Majority Leader Canizaro for bringing this forward. AFSCME members who work in social services, public health, and community know firsthand how critical these benefits are for Nevada families. SNAP not only reduces hunger, it strengthens our communities by keeping food on the table for working families, seniors, and children. SNAP allocations mean less strain on emergency food systems, better health outcomes, and more stability for families trying to make ends meet. At a time when inflation continues to challenge working families, SNAP is one of the most effective and immediate tools we have to fight poverty and support economic stability. AFSCME urges this committee to support this bill and reaffirm Nevada's commitment to ensuring every family has access to basic nutrition they need to live, work, and thrive. Thank you.
Good evening. Brian Wachter, President of the Retail Association of Nevada. We have prepared an online dashboard. You can go to nvsnapfacts.com, and we were able to compile a bunch of Nevada information specific to what the Nevada SNAP program allows. Nevada SNAP and all SNAP is economic development. For every dollar that we are spending, we are getting $1.50 to $1.80 back. SNAP is the reason that we have a robust supply chain and that we are able to get food from farm to table. And so maintaining that strength during these uncertain times. We appreciate the leadership of the Majority Leader as well as the Governor in recognizing that this is something that Nevada couldn't wait for. Our businesses have struggled to deal with this break in the supply chain. We are coming back on board. We're very glad that SNAP was approved in the agriculture budget, but we think Nevada deserves to be able to stand on its own and not be held liable for the shenanigans of the federal government. Our businesses deserve better, and our citizens deserve better, and we thank the legislature for considering SB 3.
Good afternoon, Chair and members of the committee. For the record, my name is Annette Magnus, and I am here today on behalf of my client, Moms Rising. Moms Rising is a national network of families here in Nevada and across the U.S. who are united by the goal of building a more family-friendly America. Today, we stand in strong support of SB 3. We thank the Majority Leader for creating this innovative approach to make Nevada a leader on this important issue. We would also like to thank the Governor for adding this to his agenda. The past few weeks have been a crisis for Nevada families. Many have been forced to make a decision between feeding their families and other needs that their families have. This should have never happened, and it should never happen again. Our families' food security should not be used as a political pawn. This bill gives Nevada an opportunity to lead on this important issue. We need to ensure that Nevada is able to respond if another crisis comes in the future. Our food banks do incredible work, and we also know that that cannot be the only source of food if we have another crisis. This bill helps us fill those gaps during an emergency. We urge your support.
Good afternoon. My name is Aisha Goins, AESHAGOINS, Black Joy Strategies. I'm here and my official title as Vice President of the NAACP and also on behalf of SEIU. We ditto everything that's already been said. We super appreciate the committee for hearing this bill on today and for being here because thank you so much. And we just urge your support for this bill. Thank you.
Thank you. Anyone else here in Carson City? Anyone in Las Vegas? AVH, is there anyone online?
Thank you, Chair. The public line is open and working. However, there are no callers at this time.
Thank you. Let's go on. Oh, I see someone in Las Vegas. You may proceed.
Good afternoon, Chair and members of the committee. For the record, my name is Ada Solano, and I am here today representing the Asian Community Development Council, or ACDC, in support of SB 3. One of ACDC's many services is assisting Nevadans who need to navigate applying for the SNAP system. And every day we see the very real impact that SNAP has on Nevadans' lives. The past few weeks have been incredibly hard on many of our clients that we serve. On average, ACDC signs up over 80 clients each year for SNAP services. When the federal government shut down, our clients lost access to the benefits they rely on to feed their families, choosing between rent, paying for their rent or utility, or food on their table. We cannot let this uncertainty happen in the future. This is why we support the creation of this program for the state of Nevada. We must have a backup plan for the future to ensure Nevadans have access to the food they desperately need. Please support this important bill. Thank you.
Thank you. Is there anyone else in support? I don't see anyone here or in Las Vegas. Let's go to opposition. Is there anyone that would like to testify in opposition to this bill? I don't see anyone here or in Las Vegas. AVH, is there anyone online?
Thank you, Chair. There are no callers at this time.
Thank you. And let's move on to neutral testimony. Would anyone like to testify in neutral? I don't see anyone here. Oh, I see someone in Las Vegas. Please come forward.
Good afternoon, Mr. Chair, members of the committee. Stephen Cohen for the record. Just want to bring to the majority leader's attention, happy to work with her, but in-kind supports can be an issue for means-tested benefits such as Medicaid and Social Security as well. Thank you.
Thank you. Anyone else in neutral testimony? AVH, is there anyone online?
Thank you, Chair. The public line is open and working, and we have no callers at this time.
Thank you. Are there any closing remarks? At this time, I will go ahead and close the hearing on this bill, and we will now move on to recess. Just one quick comment before we go into official recess. So the committee members will go into recess. We will deliberate on the bills that we've heard today, and we will possibly, more than likely, come back for a work session later today. So just keep an eye out for when we come back. We are now in recess. Welcome back from recess. We are going to now resume back to where we left off. As you may recall, we did two bill hearings for Senate Bill 3 and Senate Bill 5. We are now going to move on to a work session of both those bills. We will start with Senate Bill 3, and I will turn it over to Mr. Ashton.
For the record, Patrick Ashton, Research Division, LCP. So Senate Bill 3 that was heard earlier today establishes the Silver State General Assistance Program within the Division of Social Services of the Department of Human Services to provide temporary financial or in-kind assistance to eligible individuals and households who are experiencing an extraordinary circumstance. And Senator Canizaro proposed a conceptual amendment during the bill hearing. In summary, the amendment deletes the appropriations in sections 14 and 15 of the bill. Thank you, Chair.
Thank you so much. Committee members, any questions? This one is a motion to amend and do pass. Do I have a motion?
I amend that we amend do pass Senate Bill 3.
Thank you. We have a motion from our Vice Chair, seconded from Senator Taylor. Any discussion on this motion or on this bill? All those in favor, please say aye. Aye. Any opposed? Motion's carried, and I will assign that floor statement to Senator Canizaro. Let's move on to Senate Bill 5. Mr. Ashton.
Thank you, Chair. For the record, Patrick Ashton, Research Division, LCP. Among other provisions, Senate Bill 5 requires the Nevada Health Authority to conduct a biennial assessment of the healthcare needs in Nevada and establishes the statewide healthcare access and recruitment grant program managed by the authority to award grant funding to certain projects that address certain critical shortages identified by the assessment. Amendments. Senator Canizaro proposed a conceptual amendment during the bill hearing. In summary, the amendment increases in Section 8, subsection 3, the percentage the Nevada Health Authority may use for administrative costs to 3.5% from 2%, and adds a new section that authorizes the State Board of Health to modify standards or recommendations of immunization practices. Thank you, Chair.
Thank you so much. This one is a motion to amend and do pass. Do you have a motion?
I move that we amend do pass Senate Bill 5.
We have a motion from our Vice Chair, seconded from Senator Taylor. Any questions or discussions on this bill? All those in favor, please say aye. Aye. Any opposed? Motion's carried, and I will assign that floor statement to Senator Canizaro. That concludes the work session for this meeting, and now we are at the last agenda item, which is public comment. Is there anyone that would like to provide public comment at this meeting? I see no one here or in Las Vegas. AVH, is there anyone online?
Thank you, Chair. The public line is open and working, and we have no callers at this time.
Thank you so much. I will go ahead and close public comment. That concludes the work for today. We'll see if we have more work in the following days. Meeting's adjourned.